So, yeah, let's talk about implant profiles because that's a question I get asked a lot. So, the implants come in different profiles. And what does that mean? A profile just means how wide the implant is and how tall the implant is. All the implants nowadays are pretty much round, smooth implants. That's what the majority of uh, plastic surgeons are using. That's all that I use, smooth, round implants. So, they're all round, but they come in different profiles, which means that the diameter of the implant can be different. So that's just how wide the implant is, and you measure that, and you correlate that with the patient's chest, and that's the important thing. So how wide is the patient's breast? Because you can look at a woman, and they may be the same height and the same weight, but then you look at their breasts, and one may have a very wide breasts that are almost touching in the middle. And some women may have very narrow breasts and have a very wide space between the breasts. So that's how wide the breast is. So it's important to match how wide the implant is with how wide the breast is. So if a patient has a very narrow breast and you choose a low profile, which is wider, or even a moderate profile, which is wider, then that implant may be wider than the breast. So if you put that implant in someone, then you're going to overstretch the pocket. The implant's going to look very side heavy, bottom heavy. So that's not the right profile for the patient. So a patient that has a narrow base or a narrow breast may require a high profile implant. So that because that implant's narrower, it's going to match her chest and it's going to give her more projection. So it's very important to do measurements and implant sizing to determine, number one, what size implant would be best for this patient and what profile would be best for this patient. Because, if you look at size and profile, there are literally thousands of implants to choose from. So picking the right implant is key and the right profile.